So if we move from the oral cavity to the anus, we'll look at what's actually happening in each of these cavities. So we have the sensory analysis of material before swallowing, so that we don't want to be swallowing sharp bits with prickle bits or bits that we know that we don't like the taste of. Then we've got the mechanical processing through the actions of the teeth and the tongue and the palate. Then we've got lubrication, mixing with mucus and salivary secretions, and there's limited digestion, being of carbohydrates and lipids in the oral cavity. You're not expected to remember the parts here, but I'm showing you this so that you can see how involved it is. So the strongest muscle of the body, we've got the tongue there, and you can see that we've got the teeth and the cheek, and you can see the opening of the parotid duct for one of the salivary ducts. You've got the hard palate and the soft palate. And then at the back of the tongue, we've got the tonsils. There are 3 types of tonsils. You've got your palatine tonsils, you've got your linguinal tonsils, and then right up the top at the back of the soft palate, you've got the pharyngeal tonsils. Now, these tonsils are involved in immunity. However, many of you may have had part of your tonsils removed because of recurrent infections. One of the most important things that we've got here, I'll see if I can use the draw tool and see if it works, is if we look here, what we're looking at is the epiglottis. So this is a piece of cartilage which folds back whenever we swallow, so that food goes down the esophagus and doesn't go down into the trachea. The trachea is the windpipe. We'll be talking about that later in weeks 11 and 12, but it's really important that the epiglottis is working well in order to protect our airways. So one of the responsibilities for you as a registered nurse is looking after and being able to assess whether a person has got a gag reflex if they come back from having any diagnostic procedures, like an endoscopy, where they pass a tube down through the esophagus to look at the small intestine and the stomach, or even a bronchoscopy where they pass a tube down through the trachea to look at the lungs. All of those procedures will involve paralysis of the epiglottis by chemicals. So post-procedure, it's important that you can assess whether the patient has got their what is called their gag reflex back in order to protect their airway before you allow them to take any sips of water, because of course we want the water to go down the esophagus and not to go down into the trachea, into the patient's lungs, or they might drown. Okay, now the tongue manipulates materials inside the mouth. The functions of the tongue is mechanical processes and also to analyze for the touch, the texture, the temperature, and the taste. So all of that is on our tongue. And also it's involved in the secretion of some enzymes called linguinal lipase. The salivary glands, there are 3 pairs of salivary glands, and their location, if we look back at the mouth in cut section, or you have a look in your books, you'll be able to locate the parotid, the sublingual, and the submandibular. So it tells you where they are. So the parotid and the sublingual and the submandibular. Each pair has distinctive cellular organization, and they produce saliva with different properties. Surprisingly, we actually produce between 1 and 1.5 litres of saliva each day. So if a person is unable to swallow, then they're going to have about 1 to 1.5 litres of saliva being drained from their mouth every day. And you can see the proportion of where that saliva comes from the different types of salivary glands. Saliva is mainly water, but it also has enzymes and electrolytes. The function of saliva, you know, it's to lubricate the mouth. It moistens and lubricates the food that's being digested. It has dissolved chemicals in it. One of them is an enzyme called salivary amylase. So if you wanted to test whether you've got salivary amylase, how it's functioning, you can take a Jatz biscuit and pop it in your mouth and just let it stay in your mouth until it is totally soaked with the saliva. So it may take a minute or two, and then that savory taste will become sweet as the salivary amylase, the enzyme, starts to break down the carbohydrates into simple sugars. Careful with this word, mastication, also known as chewing. And this is where the teeth or the occlusal surfaces work to break up the food with crossing and recrossing across the occlusive surfaces. So again, from a nursing point of view, it's important that if our patients need to have their teeth in and correctly fitting for them to be able to get sufficient nutrition to be able to meet the body requirements. So if they do not have dentures, then their food, of course, needs to be broken down so that they can just move it around in their mouth with their tongue and then swallow it. So it'll be up to you to assess whether the person has the ability to manage a ward diet or whether their food needs to be broken down or vitamized. Still needs to be presented in a way that it looks attractive, so we don't just throw everything into the vitamizer and get this sort of green-grey mush served up in a bowl, but we can separately vitamize the potato, the pumpkin, the green vegetables and the meat, and then serve them up looking attractive but in separate colors. Remember, we eat with our eyes, so if it doesn't look attractive, then the patient is not going to be involved in wanting to eat it very much.